Dental amalgam is a material that has stood the test of time and is still commonly used by many dentists today. Amalgam is formed through the process of amalgamation, that is, an alloy reacts with mercury to form a silver, hard, grey mass that can be used to fill any cavities you may have in your teeth. Because this material has a silver or grey colour, it is not considered to be the most aesthetic filling material. Amalgam used to be the most common direct filling material used in posterior teeth. Today, the use of amalgam is declining. This is due to concerns surrounding the safety of the material and the environmental pollution linked to its use in dentistry. However, there is an ongoing search for viable alternative materials to be developed. There are two compositions of dental amalgam, the conventional type and the high copper type. Today, the high copper composition is the most popular. Both of these compositions contain the same components but in different quantities. These components include silver, tin, copper, zinc, and mercury. The conventional type was higher in silver but lower in copper. The high copper type, as the name suggests, is higher in copper at the cost of lowering the silver content. The purpose of this substitution is to increase the strength of the material. As amalgam sets, it actually shrinks slightly over the first 30 minutes due to the mercury diffusing into the alloy. Between 30 and 60 minutes, there is expansion as crystallization kicks in. The overall result is that there will be either net expansion or contraction, but as long as it is within a reasonable limit, around plus or minus 0.1%, then the material is still good for use in our fillings. When the patient leaves the dental practice, their new filling still has a long way to go before being fully set. It takes around 24 hours for amalgam to fully set, so that it is as strong as it can possibly be, which is important when you're going to be eating on it. We have to remember that amalgam is still a metal material, and as a result it will transmit heat from food and drink that enters the mouth through to the inside of the tooth, potentially damaging the pulp or the blood supply of the tooth. However, in reality this is not a big issue at all, as hot food and drinks don't normally spend much time in our mouths as they pass through and are swallowed uneventfully. Mercury is one of the components of amalgam, and technically mercury has been known to be toxic to our central nervous system. In 1998, amalgam fillings were banned by the Department of Health for patients who were currently pregnant. Some reports claim that there are links between the mercury content in amalgam fillings and the incidence of behavioural problems and psychiatric disturbances. But this is still a very controversial area even today, with many believing the minimal mercury content that is actually in a filling would be unlikely to cause any significant effects. Environmental pollution is another reason why amalgam is being phased out. The water used in a dental unit must be filtered so that excess amalgam does not infiltrate the water supply. Also, when someone is cremated, mercury can be released from any amalgam fillings the person has. This mercury is released as a vapour into the air and will be able to contaminate water, wildlife, and even other people. When a dentist is placing an amalgam filling, they will pack it into the cavity and carve it to the right shape. This helps to remove some of the excess mercury. This video has looked at what is in an amalgam filling. Which topics would you like me to cover in future videos? Leave a comment below, subscribe if you're new, and I'll see you in the next one.